Welcome to Practical Nursing Pro. Today we're covering the top 5 NCLEX-PN questions that students consistently get wrong. By understanding these questions and the concepts behind them, you'll be better prepared for similar questions on your exam. These questions cover critical areas of nursing knowledge that are frequently tested and often misunderstood. Let's jump right in. All right, let's talk prioritization. Picture this. You're a nurse on a busy floor, and you've got 4 patients who need your attention. One has new onset confusion, another has a stable heart rate, the third needs their next dose of medication, and the fourth is asking for help to the bathroom. It's a real juggling act, right? In nursing school, you learn all about prioritizing patient care, and it's crucial to remember your ABCs: airway, breathing, and circulation. But what comes after that? Well, right after ABCs, acute neurological changes like sudden confusion should shoot straight to the top of your priority list. Think about it. New onset confusion isn't something to be taken lightly. It can be a red flag for something seriously wrong, like a lack of oxygen getting to the brain, a potential stroke, an infection, or even a head injury. Remember, as nurses, we're like detectives, always looking for clues. And sudden confusion? That's a major clue that something needs immediate attention. Don't brush it off as the patient just being a little out of it. Dig deeper, assess the situation thoroughly, and make sure you're ruling out any potentially life-threatening conditions. Next up, let's talk about diabetes management. Specifically, what do you do when a patient's blood sugar takes a nosedive? Imagine you check a patient's blood glucose level and it reads 45 milligrams per deciliter. Yikes! That's low. We're talking hypoglycemia here, people. This is a situation where you need to act fast. Remember, a brain without enough glucose is like a car without gas, it just won't run. In this scenario, your priority is to get that blood sugar back up quickly and safely. And that's where the rule of 15 comes in handy. This rule is a lifesaver, literally. It reminds you to give 15 grams of fast-acting carbohydrates. Think a small glass of orange juice or some glucose tablets. These quick-acting carbs will be absorbed into the bloodstream rapidly, giving that blood sugar a much-needed boost. Now here's the thing. Don't just give the carbs and walk away. You need to recheck their blood sugar after 15 minutes to see if it's going up. If it's still low, you might need to give another 15 grams of carbs. And of course, always keep your doctor or healthcare provider in the loop about any hypoglycemia episodes. Remember, quick action is key when it comes to hypoglycemia. Chapter 3. Now, let's talk about heart failure. It's a condition that affects so many people, and it's essential to know the different ways it can present. One of the trickiest things for students is understanding the difference between left-sided and right-sided heart failure. So, imagine you're listening to a patient's lungs, and you hear a crackling sound, especially at the bases. That's a telltale sign of fluid buildup, and it's a classic symptom of left-sided heart failure. Think of it this way. The left side of the heart pumps blood to the body. When it's not pumping effectively, blood can back up into the lungs, causing that fluid buildup and those telltale crackles. Now, this doesn't mean you should ignore other possibilities. Always listen to your patients and consider their medical history. But those crackles, especially in the context of heart failure, should definitely raise a red flag. Chapter 4. Let's move on to medications, specifically a drug called furosemide, also known as Lasix. This is a powerful diuretic, which means it helps the body get rid of excess fluid. Now, here's where things get interesting. When you're giving a medication like furosemide, it's crucial to keep a close eye on the patient's electrolytes, especially potassium. Why potassium, you ask? Well, furosemide can cause the body to lose potassium along with the excess fluid. And when potassium levels drop too low, that's called hypokalemia, it can lead to some serious complications, like dangerous heart rhythm problems. So, if you're ever giving furosemide, make sure you're monitoring those potassium levels like a hawk. And be on the lookout for any signs of low potassium, such as muscle weakness, fatigue, or even changes in the EKG. Remember, early detection is key when it comes to managing electrolyte imbalances. Chapter 5. Finally, let's talk about one of the most critical aspects of nursing, knowing your scope of practice. As an LPN, you play a vital role in patient care, but it's crucial to understand the boundaries of your practice and what you're legally allowed to do. Here's a common scenario. You're working on a busy floor, and the doctor asks you to administer a medication. Sounds simple enough, right? But before you even touch that medication, you need to ask yourself, is this within my scope of practice as an LPN? Now, in most states, administering medications is well within the scope of practice for LPNs. You've received the training, you know the 5 rights of medication administration, and you're comfortable with the process. But always double-check your state's Nursing Practice Act to be absolutely sure. Each state has its own specific guidelines, and it's your responsibility to know them inside and out. Remember, staying within your scope of practice not only protects you legally, but it also ensures that your patients are receiving safe and appropriate care. So there you have it. Those are the top 5 NCLEX-PN questions that students often miss. Remember, prioritizing patients using your ABCs and recognizing acute neurological changes is crucial. Knowing how to respond to critical situations like hypoglycemia can literally save lives. And understanding those tricky heart failure assessments and medication side effects is all part of being an amazing nurse. Most importantly, always be aware of your scope of practice. It's there to protect both you and your patients. I hope this video has been helpful in giving you a better understanding of these important nursing concepts. Remember, the NCLEX is tough, but you are tougher. You've got this. If you found this helpful, hit that subscribe button for more NCLEX-PN prep videos. And in our next video, we're diving deep into diabetes pathophysiology, making it super clear and easy to understand. Thanks for watching, and good luck with your nursing journey.